And so those are the additions, and we will need a closed session.
Do you want me to go ahead and pass out the copies for those two additions?
Yeah,
Mr.
let's-
Chairman.
Yes.
Mr. Wood, back to the unfinished business, the architects for the EMS stations, you will bring us up, you or Craig one will kind of fill us in on where you do,
Yes,
where we stand on that?
yeah, I will.
Okay.
I will.
all right.
Does that also impact the Shell buildings as well?
It does, because it's the same architect.
I thought so.
We have, I can go ahead and tell you now where we're at.
That's fine.
We have reviewed the contract. We met with him after we had selected him. We nailed down the scope of work, made sure he was clear on everything. And then he has presented a proposal to us. We met, went over his proposal, and then we emailed him back with what we thought needed to be changed on it. And I'm waiting to hear back from him now on that. And so what I've suggested to Craig is, since y'all won't meet till the 16th, is when we get that back, is to just email y'all as a group and tell you what the contents are. And then if y'all are in agreement, we can go ahead and authorize that. And then you can come back on the 16th and formally approve it. But, because I don't want to waste that much time, but we just haven't gotten back together on it. But we're close.
Okay.
The details are not that significant as far as
I
where
don't
we're
think so.
apart.
We're different on the fee, is what we're different on.
Can we possibly approve it subject to you all coming up with an agreement?
Is that all right?
Yes.
If you want to do that, that'd be fine, and then we'll just notify you.
Would that expedite it some or speed
Yes,
it
it
up?
would. Yes, it would, because I'll be honest, I didn't know we weren't going to have the January 2nd meeting, and I don't want to lose a month on this.
You said we.
He's gonna keep his same phone number.
Oh, yeah. It'll take me a little while, Joe. Craig doesn't want to lose a month on that.
So I guess we'll leave that under unfinished business then?
Yeah,
So-
we could leave
okay.
it that.
Okay.
I mean, that's a good way to do it if Borden's okay with it.
We'll
And then
just
what
put
we
a
will
subject
do,
to.
what we will
Subject to
do is,
negotiated.
what Craig will do is send you an email that gives you the details of what we worked out. But it's primarily the fee.
Or should we include the Shell building and all that, or?
It's the same.
Okay.
I mean,
Is
it's
that a-
all one contract.
Oh, I'm
So
sorry.
that-
Yeah,
so
that's
that
right,
will-
Larry. I'm sorry.
So that will be an
Yes, sir.
action item now?
Yes.
Yes, we'll just leave it on.
Anything else?
I think those are the only additions and deletions, unless, Carol, do you have anything else?
No, sir.
Commissioner, do you have anything you need to add or take out? Okay. Then we're moving on to consent. I'm sure those exclusions are fine.
Yeah, they're
Any issues
fine.
there? All right. Then we'll go ahead and get to the budget amendments.
Yes, sir.
If you witness. Please silence your cell phone.
Not me, just so I'm holding my phone.
Thank you.
It brightened up our morning.
Yeah. Oh, you get it. Hello?
The first budget amendment that you have is for the detention center. This is just a reallocation, $15,000 from professional services to vehicle supplies. For central services, you have an addition of $8,164 for the unemployment insurance line item. This is to maintain the required balance that we have in the unemployment account for the state of North Carolina.
Okay. That's what I
For the
thought.
Juvenile Crime Prevention Council, $263.62. This is to shore up their account for June 30, 17, some unspent funds, and to reimburse the state for those unspent funds. For social services, a reallocation amount of $6,400. This is to cover the ExecLink, the various ExecLink contracts that we had earlier in the year for our interim social services director. For planning, the amount of $39,000. This is for the open broadband study that you all have approved, but we just had not done a budget amendment yet. You will notice at the bottom that we are also anticipating $4,800 of this from the city of Goldsboro. And then finally, for social services, $45,267. They are balancing to their funding authorization from the state for the low-income energy assistance program.
Any questions of Ms. Spade? I do have one question, it's not her. On the broadband, we worked out and negotiated the issues there, you know? The one issue we had. Still working on it?
Still working.
Okay. If you'll keep us updated, I would appreciate that. Okay, next is a motion to approve a petition for NCDOT to add Artesia Drive and Marcella Drive and Corbell Drive.
Yeah, this is just a standard matter where you've got people who petitioned the DOT to take these over, and everything's in order, but it's standard procedure that it comes through you.
Okay. Next, we've got a nomination to fill a vacant seat on the Eastern Wayne Sanitarium Board, as recommended by their board. My understanding is that one of the fellows that won no longer lives in the district and
That's
can't
right.
serve, so the other guy was the next one in line and had served previously. Is that correct?
That's right. So if anybody got an issue with that?
And moving on from that, we got sale of surplus property. Want to cover that?
Yeah, we've got two properties there. We own jointly with the city, and it's 1.85 acres on this tax map for $12,125, and the other property is 5.88 acres, and it's $36,565. They're both, one is on South Weaver Drive and one's on Highland Place, and actually, they're adjacent to each other.
And those are just off of Slocum Street? Is that what
Yeah,
they're-
that's Slocum to the left.
Left, yeah.
So you've got that one, and then the next one is right there. So they actually abut each other.
Looks like it's wooded, most of it.
It is, it's undeveloped property, so apparently somebody's wanting to do something with it.
Do you have any information on this community technical assistance? This, it's a nonprofit that's buying it.
Yeah, I really don't. The city worked all that out, and we're just concurring in it.
Any additional questions?
So if it's being purchased by a nonprofit, so it still would not be on the tax books?
Depends on what they do with it.
Okay.
Hadn't thought about that. Of course, 6 is what you added about authorizing us to, the board chair and the clerk to sign the, execute the fire contracts.
That's right. And I think we've given those, they've got those copies.
That it's the same agreement with the minor changes that was requested, and they were not substantive changes, so we recommend approval.
All right, moving on to new business, we'll have a presentation from a David Rosado, Director of the Eastern Carolina Council here on Aging. He'll be coming in, I assume. And then Mr. Madden will be next up, and he'll talk about the fee schedule and bad debt write-off.
And if y'all have no objection, David would like to go now because
Okay.
he's got a meeting. We're trying to recruit a dentist, and
By all means,
You got
come on up,
it.
Mr. Madden. Did we pass the health inspection back there?
Looked good, looked really good. I saw some good practices back there. It was really clean, sanitary, excellent. Well, good morning, yeah. Let me get my paper out here so I know what I'm talking about. Yeah, this shouldn't take very long. What we have 2 items that I need the board to take action on. The first item that I'd like you to consider is our fee schedule. This is something that we do annually. We don't always bring you a new fee schedule to approve annually because sometimes when we do the fee study, the price differentials are not really significant enough to have staff do a complete overhaul. In this particular case here, it was about time for us to look at some of the fees that we had set previously based on the cost of the medications that we were purchasing, adjustments to get our fees in line with those costs, and we made a few adjustments in order to just maintain our ability to serve as a safety net. And what that really means, guys, is some things we may not if a drug has a certain price, we may not actually impose a full administrative fee when we set the fee. The additional administrative, that just allows us to keep it where it's affordable for people based on its accessibility. So that's one item that I'm asked the board during your meeting to take action on, is to approve the health department's fee schedule for 2018. Well, actually, it would be effective as soon as you approve it. And then the second item is, Carol, did you provide them already with that debt set-off sheet?
That's what I just
Okay.
handed out, yes, sir.
And the second item, and I'm not really familiar with this, if this is something we've brought to you every year, because that's why we're going to bring it to you, and I don't know how the county manager and Mr. Honeycutt taking position, how y'all feel about that, but it's something that the board approves every year, and we decided we'd bring it to you to see if it's something you'd also be interested in. But this is our debt set-off program and our debt collection program. Basically, our debt set-off, our bad debt write-off and our debt set-off, that Allison, well explains this to you, but this is where we have the ability where we have unpaid fees that have been provided for services, and if they don't have them paid, we roll them into debt set-off. We actually enhanced it because now we actually do personal tax ID numbers on top of like socials and stuff, so that if you don't actually have a social security number, but you're working here in the United States or in Wayne County, you'll have a tax ID number, personal tax ID. We use that now to levy against our debt set-off too. So you see the amount there for debt collection. The current amount at this last print was $72,858.91. And then the part that talk about taking action to, as far as our written off component, is really the action for the board is the $31,122.23, and that is basically services rendered that we have deemed now to be uncollectible. Mr. Daugherty, brought a lot of questions back years ago when he was on the board, and if he remembers when we first started on the board, sometimes those written off numbers were in the like $60,000 and $70,000. But we've managed to do a pretty good job to get those down now. And we try to keep them down year to year. It's always kind of random. But that's where I'm asking you to take an action on just approving the bad debt write-off for 2016.
Questions?
I have a question, but I think Mr. Wood might
Okay.
answer. The debt, writing this off, I know that we have that contract by the other company where uncollected debts. How related is this to that?
I think basically what we're saying is they've tried that, and they just haven't been able to collect it. At a certain point,
It's
it's just not collectible.
okay. All right.
That's correct.
And while there's just one thing that I probably, each time I've had an opportunity to share in the fee schedule adjustment. You said that you spoke about the medicine needing to pass that cost along, but we're approving several pages. And is the medicine increase the only thing that there are other increases scattered through here that
No, this is specifically
that are
tied to the
designed
medicine.
to make you more in the black than in the red, but it's not necessarily in the red. But is there some adjustments in here for services and things that is optional?
If I understand your question, Mr. Cromartie, no, I would say there's not. We made a administrative fee adjustment, I think it was last year that the board approved that. That was the only thing that really ties into the actual physical services rendering besides the purchase of the vaccine or the medicine supply. So no, I would say no to that question.
So there's not any increases in here that has to do with directly affecting salaries. I mean, I think if the folk that you have are working and getting paid, and that's taxpayers' money, are we turning around and increasing fees that would have something to do with salary that is also increasing what the public has to pay? I can understand the medicine. You can't control that. But I'm just wondering if there are things scattered in here that.
No, sir, this is independent of the salary and fringe of the health department. This is tied directly to an algorithm that we have to use to evaluate fees based on the cost of the vaccine medicine that we render, and then where it's appropriate, we levy an administrative cost, which we're allowed to do, and that is something, in a couple of these, we've kept the administrative cost basically zero because the cost of medicine.
But the
is already
administrative
kind of-
cost is the human addition side of this, right? The administrative cost, is that the human,
That's, sir, that's correct.
that's the human increase side of it?
That's correct.
And that's determined as a need based on what?
That's really based on a cost analysis of how much time typically we look at goes into rendering the service. And
All
then
right.
we take that unit of time and we base that based on an average
So
operating cost.
therefore, you are, that's designed like any, it sounds like it's designed like any other for-profit business.
I'm
It's
sure.
not tax supported by the
Well,
public.
I think what he's saying is it's a combination. It's some fee supported and some tax supported. So if you didn't have these fees, you'd have to raise taxes to offset that revenue. So it's really a combination of the two.
Does that answer your question?
Yes, but it doesn't satisfy the itch, I don't think. That's a great answer. I mean, and I understand that.
Well, remember,
But
we're
there's a
required
piece of
to
me-
charge, we're required to charge as a health department, we're required to charge for these services based on our cost. I mean, that's a requirement. in order for us
Required
to-
by the state,
By our consolidated agreement and our agreement in
but by the state or by the Board of Commissioners here?
the state of North Carolina because of the way we handle, because we receive both federal and state dollars in addition to our local dollars. So we're required to set up a fee schedule to try to recover our costs to the best of our ability. We don't do that in a way that levies an unnecessary burden on the user, but at the same time, we are required to evaluate and try to be as cost-effective as we can to recover those costs. Because otherwise, we'd, like Mr. Wood was basically alluding to, we'd operate exclusively on the county dollars if we didn't do that, and that would be impractical to be able to render the level of service we provide.
Thank you, sir.
Thank you.
Mhm.
I did have a question for you.
No
I
questions.
think
No
I asked
questions
this
till after
question
Christmas, Mr.
several
Goddard.
years back, but I want to make sure that I'm understanding. It says over $50 with no social security number.
Correct.
Can you explain that?
If it's, our policy said where if it's less than $50, we really consider that not really worth the time it takes to go into the whole process of doing the debt write-off.
No, I'm talking about the no social security number.
Yes, sir.
Will you
Well,
explain that?
that's why these are typically uncollectible, because we have no full identifier to be able to actually locate and use any of our leveraging tools to be able to recover the money.
All right, I'm going to ask it in a different way then.
Why?
How can people not have a social security number?
Well, they're not considered a legal citizen, and they haven't prompted
So
up
who mandates that we must provide that service?
the federal government.
Federal government.
Correct. Because we receive federal dollars, we're required to be a safety net provider to anyone. And we can't turn them away due to their inability to pay or their status.
Or their status.
Yeah.
Whether they're in the country legally or not,
That's
we
this-
cannot
this-
turn them
this is
away.
Correct. And like I said, as much as that, I know that sometimes creates some turmoil with people, you know, in a lot of things what we do.
Well, it creates turmoil with me. I mean,
Sure.
here we're talking about maternity, and evidently it's a large number. So,
That's right.
and they have no social security number.
Typically,
So that, so they come into the United States, and the taxpayer pays for the birth of their children. Is that correct?
this is correct.
Have a good day.
Thanks, sir.
Because you've
And
run
then the
hours.
child is going to be a citizen.
I understand.
I'm sorry, I didn't understand.
I said, then the child who's born here is going to become a citizen.
That's right.
Right. That's called.
I'm sorry, the Grinch came out of me just a moment. Go ahead.
Well, I was gonna make a suggestion, since he's not gonna be here, that we move this to consent agenda. Is that okay with everybody?
That's fine. That's
Yes, yes.
Yes, both items. So let's
Yeah,
make that, what, 7, would that be 7 and 8, or just 7?
It's all in one.
Yeah, I thought it was. Okay. All right, after that, we'll have our audit. Dana's gonna be here. Is anybody coming
Yes.
with her, or just?
She'll be here.
Okay,
Paul Harrell may be with her, I'm not sure.
okay. And after that, we're gonna have a number of resolutions that we'll need to adopt with the CDBG-DR. We need to go through all those.
I think it'd be good, Chip, you and Dave want to get up and go through these.
But I was reading those things yesterday. I was wondering if we could put them all in one vote. Can we do
Yes.
that?
Yes,
Thank
you can.
That'll save a lot of time.
It would.
Thank you.
Morning. I know it's hard to think back, but at the beginning of each of our community development block grant projects, this is what the board approves. Policies and guidelines, financial management resolution designating who's going to be your signatory officials and who's going to be the bank depository, and of course your budget. In fact, with the last project, we adopted these in October 2015. The CDBG-DR program requires they be readopted for another 3-year period, and those are the 14 or 15 or so that you'll be approving. And then the other item, like I say, the financial management resolution, and of course, project budget orders. I'm glad to answer any questions about them.
Mr. Chairman, on page 81 and 82, I would recommend that you take Mr. Wood's name off of that and substitute yours. It's to have 4 people, so in case somebody's not here, that you've got enough people to sign.
Okay.
And,
On that second paragraph.
yes, sir, the telephone's not going to work for the signature.
No. Okay. Any questions of Mr. Harris?
Well, I have a question. It might be for the finance. Well, I'm not sure. Let me back up just a minute. Yesterday in the great News August, Mr. Herron, down at the bottom of the page, gave a list of things that those dollars would be spent for. Mr. Herron, is that, he's busy, but it's got about 6 or 7 things that make up that $16.94 million, I guess. My eye just picked up on the administrative cost for $400,000, and then a planning portion that was $1 million. Those items look, I mean, is there any relationship between the administration and the planning, and who's doing which part, and finance? Will we see a line item budget on this rather than just, I mean, it's big categories. Will we see a line item budget on this?
Well, we did the budget. The state required those categories, and we actually negotiated with them on those categories. So you, that's the budget you approved. And part of what you're doing today is his contract, and that's gonna be $1.9 million. So a lot of that is gonna be covering some of those costs. That's what the administration and planning is for. And he had the lowest contract price.
Right. Yeah, we
think we did
understood
that in the
that
last
back.
meeting.
We understood the award of it. through the bid process, and I understand the low bid. I was talking about being able to see a more detailed breakdown of what these 7 or 8 categories are.
I mean, we can go through them with you if you want to do that.
No, that's not something I wanted to do today.
Okay.
I was talking about a visual that could be seen over time, not.
Well, I think as he goes through it,
I can provide that.
he'll provide that periodically.
These are the categories that are in your grant agreement,
Right,
and those are the ones, of course, you base your project budget ordinance on. Within each one of these are sub-projects and subcategories
that's.
with detailed information on
That's-
cost and units, et
That's what I-
cetera.
That's where I was.
And I can provide you that breakdown.
And just so, because I know our members up here sometimes fade, what kind of a regularity you think we see that? Quarterly, semi-annual, what would be good for us to be able to see it? I mean, 3 months, every 6 months, or what would be good for you?
It'll be at
to look
least
for us?
quarterly.
Good.
We'll have a summary that they provide at least quarterly. There are some items that the state may require monthly,
Thank you, sir.
and any of those reports that go to the state go to the board.
That's the one, that's where the hunt was headed for. That's it. Thank you.
Any additional questions?
I don't think they have them.
Thank you, David.
Well, we're gonna combine those.
Yeah, yes.
Or to-
Can.
We'll have him write out the motion. So we'll do it properly. Okay, let's see here, financial management. Oh, okay, we're at the 18th Amendment, the position classification.
Right, and what, the three for the Maxwell Center, you had already verbally approved, but this is to formally do it. And the last one is to increase the social work program administrator from grade 75 to 77. We're having some issues trying to fill those jobs, and so we feel like we need to take those up. And Ms. Shrinker is here if y'all want to talk about that.
There was a little bit difference in the cost, but about $6,000.
Tammy, do you
So
remember?
I saw that in here somewhere.
Good morning. It is about $6,000 to $7,000, but we expect at least a 50% revenue for that. So really, county costs, we're talking between $3,000 and $4,000.
Okay. Let's forget about that. Anybody else? Okay, we're good.
Would you like her to stay for the meeting?
No.
All right, after that, when we get back from our, and we may have another additional closed session, I don't know, but then we'll go over the facilities master plan as requested by some of the commissioners last time in the work session.
Right.
And comments from both Mr. Wood and the commissioners. And let's see. And a reception afterwards.
Yeah.
Is there anything else?
I think that's it. One thing, Carol did hand out to you, so when the auditors come, the slides that they're gonna go over, this is them.
Oh, okay.
And we also have, for you in the conference room, this is the audit that they'll be going over. But that's a condensation that they're gonna go over with you this morning, because we couldn't possibly make it through this thing.
And we do need to have a closed session this morning, is that correct, Mr.?
Yes, sir.
And that's for what reasons?
One is to discuss location and expansion of industries. One's to consult with me to preserve the attorney-client privilege, and next to establish positions with respect to acquiring property.
Is there a motion to go into closed session?
So moved.
Got a motion? Any discussion? All in favor? Raise your hand.
Yeah, I got it. It's in.
Just a little bit of it.